Hey Freedom Lovers, this is Dr. Peterson Pierre with America's Frontline Doctors bringing you today's Daily Dose. So plastic surgeons are increasingly expressing concern about the use of hormones and surgeries to help minors who experience distress associated with their sex. Many, however, fear that voicing these concerns will bring professional and social blowback. So there's always a risk in doing what's right. But you have to ask yourself, is it worth it? Quote, "It's a real problem when colleagues are afraid to debate any medical treatment or procedure, and especially when minors are the patients," end quote, said Dr. Sheila Nazarian. She continues, quote, "I have been following the international debate on youth gender medicine for some time now, and know we in the US are far behind in recognizing the lack of evidence for long-term benefits, something that our European colleagues have done," end quote. One obstacle to having productive discussions, Dr. Nazarian said, is the partisan divide over youth gender medicine, which leads physicians to believe that disagreement with the gender-affirming approach is driven by political and ideological considerations. Just as an aside, it's just like Satan, the father of lies, to twist words. To me, gender affirmation means affirming the gender you're born with, not affirming a gender that you can never achieve. Regardless of why the issue is polarized in the US, the growing international consensus against the gender-affirming approach for minors is anything but partisan. In Finland and Sweden, for instance, left-leaning governments implemented restrictions following systematic reviews of evidence by independent healthcare quality agencies. In the UK, the NHS commissioned independent review of the Gender Identity Development Service led by Hilary Cass, prompted the Tory government to ban puberty blockers, a move subsequently endorsed by the new Labour government. The US is one of the few Western countries where minors can receive gender surgeries, according to a new report. Teens under 18 cannot undergo double mastectomy in Belgium, Finland, Germany, Luxembourg, Sweden, the UK, and 3 Canadian provinces. Countries that allow these procedures typically do so only in rare cases after age 16 and with parental consent. In the US, WPATH Standards of Care version 8, widely followed and endorsed by the Biden administration, yes, they hate children, specifies no age minimums for gender surgeries. In June, unsealed court documents revealed that WPATH eliminated age minimums for political reasons and under pressure from U.S. Assistant Secretary for Health Rachel Levine, a transgender woman. An estimate of U.S. gender-affirming double mastectomies published last year in the Journal of the American Medical Association reported 3,125 cases of, quote, breast or chest procedures, end quote, in patients aged 12 to 18 between 2016 and 2020. A new analysis of the Manhattan Institute using a more up-to-date all-payer national insurance database from 2017 to 2023 found evidence of 5,288 to 6,294 gender-affirming double mastectomies for girls under 18. This includes 50 to 179 girls who were 12 and a half or younger at the time of the procedure. That is just criminal. The actual numbers are probably significantly higher because the 2023 data are incomplete and the study only looked at procedures covered by insurance. Obviously, it wouldn't include procedures that patient paid for out of pocket. A growing trend in gender medicine is non-binary mastectomies, a procedure that some patients seek in order to appear neither male nor female. According to our data, a minimum of 1,873 such procedures, a conservative estimate, were performed on girls under age 18 in the US between 2017 and 2023. The number of procedures grew from 70 in 2017 to 470 in 2023, an almost seven-fold rise. Plastic surgeons who perform these procedures leverage the existing billing code for breast reduction, a practice some might argue amounts to insurance fraud. When speaking to the public, American gender clinicians have a tendency to vastly understate or even deny the existence of gender surgeries on minors. For example, in 2023, Marcy Bowers, a plastic surgeon and president of WPATH, told CBS News that, quote, surgery really is not done under the age of 18, except in severe cases. And even that is rare. I think the estimates are something like 57 surgeries under the age of 18 were done for trans individuals, end quote. See, the thing is, when you're gonna lie, you have to make sure the data is not readily available for people to see. You're a liar. At an April 2023 hearing before the Texas Senate Committee on Health and Human Services, Cody Miller Pike, a physician and gender medicine advocate, said that, quote, children under the age of 18 in this country do not have gender reassignment surgery. There isn't a single case, end quote. Again, pathological liar. Texas Pediatric Society President Louis Appel testified that, quote, surgeries are not part of the standard of care, end quote. Interesting, because this was 7 months after WPATH published its standards of care, version 8, which includes gender surgeries with no age minimums. So these doctors are not only unethical, they have complete disregard for the Hippocratic Oath. They commit insurance fraud to perform permanent mutilating procedures on minors, then lie about it to the world. Why are they still allowed to practice medicine? Why are they not locked up for crimes against humanity? Similar to the issue with the COVID shots, lawsuits will probably start rolling in, and hopefully justice will be served. But until then, children's lives will continue to be destroyed. Ladies and gentlemen, only the truth will set you free. Stay tuned for the next Daily Dose.